Hi everyone. I know I don't look it, but it's Dr. Schneider. I am dressed this way because we have very serious issues to discuss and I might need to hide my identity from others. Several times each year we come together in either a group or individually and you discuss a patient's treatment plan. I don't want to make robots out of you, but there are ways to describe your patient to me or seminar group that makes it easier to understand and follow. There are common formats used and I shall describe one that works for me. It will likely work for you too. The first thing you want to do is introduce your patient to me or to our group. Once your patient is opened in Romexis, go to Images and open the photo study. To maximize the study, press the Image Browser button once again. This is what you will see. Now you can describe your patient's chief complaints, medical history and any other relevant information. Pass around your mounted study models and briefly describe the occlusion and other interesting features. The next thing you will want to do is to place the X-rays on the screen. Start with a pan, if there is one. Briefly discuss the general features, like multiple missing teeth, impactions, etc. It is not time to be detailed yet. Be patient. Now place the full mouth survey, or X-ray study on screen. Summarize what you see. Again, you are not ready yet to go ballistic. Hold on. So far you have introduced your patient to me and described the chief complaints. You have summarized the medical history and dental issues in a general way, and I observed your properly and meticulously mounted study models, photo and radiographic studies. I should now have a good idea as to where you're heading. It is now time to get serious. Step 4 in the 6-step treatment planning process is one of the more important parts in developing a definitive final treatment plan. Why? First, it makes you think about options. Second, because you must write them down, it forces you to be thorough. Third, it provides an opportunity to discuss the options with your patient, who can then make an informed decision as to which route you will proceed with. The final treatment plan is called the selected plan in Romexis. You will note that the exact fee, or if not possible, a range of fees is entered beside each procedure so there won't be any surprises when your patient goes to pay. And finally, a very useful and important addition to the plan is the schedule for treatment. All appointments are outlined as to what you are expected to do at each patient visit. And that is it. You're done. Well, not exactly. It is now time for questions and answers. Make sure you know your patient well. For example, know the medications your patient might take and their dental implications. Any question either about your case or general dental questions can be asked. The question may or may not refer to your case. So be informed. Here are guidelines to follow. Your presentation must be 10 minutes or less. The total time for each presentation is 30 minutes. You must supply to your clinical advisor a treatment plan summary of 1 to 2 pages. No more. There are a number of ways to work with Romexis. At the beginning of this video I mentioned a few tips to work with photos and X-rays. There are a number of ways to maximize your experience with Romexis, so ask your clinical advisor, Nella or Nadine, for help. One final comment. Does your treatment plan answer all the needs of your patient's chief complaints? If so, go to the head of the class. Thank you.